So a good place to start is with thanking you for just having a conversation with me today about all things eating disorder related. And I think a good place to start would just be with giving us some sense about how it is you got interested or involved with working with eating disorders.
Sure. When I was 20 years old, I was a dancer. And I saw a tremendous amount of pain and suffering in that area, in that profession. And I was a woman in this culture. And I saw so much pain that when I came to graduate school was what I wanted to study the roots of and the etiology of.
And what did you see when you were dancing? What did you see, and how would you describe that pain?
Well, it was an ethos of bodies that had to have one form and one form only. A sense of, I remember one of my choreographers was very aware, and he would weigh everyone, and he would, aware not in the good way, but aware of the body on the stage and the line, and that was that, and completely, fostered an atmosphere of diet.
And so literally it was sort of a one-size-fits-all, that you were all expected to conform to this one stereotype.
Yes.
And then if there were deviations from that, if people didn't fit that, how did they
wouldn't get the role?
Oh, I see.
They wouldn't get the part.
So you were punished for being different. Okay. And so when that was this in ballet or in jazz, or what kinds of?
Everything except modern dance. Modern dance has a little bit more possibility for different body shapes and sizes. But in any kind of shows, any kind of ballet, it was all the one, 5'7", 112 pounds would be good,
wow.
Which is not correct for...
Right.
Yeah.
So interesting. I mean, across all these widely variable genres, still the same expectation of uniformity.
Definitely.
And then, so part of the way uniformity got dealt with, the lack of uniformity got dealt with, was punishing, that you just didn't get the role. Were there also like emotional pieces to it? Was there comments or criticism, or how when somebody would deviate from that, what was the emotional world like inside for the dancers?
I think one of the worst thing was in a certain group that I was in, there was a scale in the locker room, and the choreographer had us line up, and he would weigh us in front of everyone and basically say yay or nay.
Wow.
Yeah.
So almost a public humiliation. Wow. So not just a private disappointment, but a public act of humiliation.
Right. And so, I was pretty lucky. I had the body type, but my roommate was not. She was a larger girl, and I saw for the first time a binge purge that came out of binging. Nobody even knew what bulimia was then. There wasn't a word for it.
Right.
But you were either starving, dieting, or they were figuring out ways to purge.
Wow. So you came by your interest in the area of eating disorders naturally, by virtue of your own experience.
Yeah.
And so then that elided into your graduate studies, and how did you come to think, well, gosh, maybe I'll work in this area, or maybe I'll...
I was so enamored with the literature that led to the early beginnings, the developmental pieces of why some women and some women do not end up with eating disorders. And it became just a complete focus for me and fascination, attachment theory particularly, and a variety of different theories, but that became so fascinating. And what was the rest of your question?
Well, just about you came to the interest sort of naturally, and you decide you'd do something about it,
right?
And then you've come to develop an approach in a way,
right? And I also think it was a time it was in the 80s where women were just starting to reap the benefits of the prior movement, and so it was becoming a big deal for women to fight the stereotypes of what was beautiful. And that was very, very big for me to have a hand in that, and so my work began as an eating disorder specialist with a team that I developed, but the emphasis for any kinds of speaking, it was treatment, but it was also a sociocultural
Okay, so it's interesting. Let's talk some about that, because I was hearing in the themes of your description things that were not just emotional and individual, but also relational, interpersonal, sociocultural,
Correct.
and
All of
so
it.
tell me about this team. I mean, this sounds like
Yeah.
pretty interesting.
The team was myself and another therapist on a college campus, a psychiatrist, a nutritionist, and a physician.
Uh-huh.
And then we did a lot of prevention work as well. We would go, at the time, later on, we had a health educator who would do a lot more. But it felt for me like I was doing the clinical work, bringing together all of those pieces, but also to go out and lift awareness. That was huge part of what I did on a college campus.
Well, and you did it in a way that it sounds like not only happened at multiple levels, but also inherently interdisciplinary.
Absolutely.
Because the people you're talking about bringing in medicine and nutrition and
Yes.
psychology and
Yes.
so.
I think the thing that, if there's one thing that I talk about when I'm working with a client or a family or professionals, is that this particular disorder has to be treated across the board. That therapy alone isn't going to do it. Nutrition alone isn't going to do it. And forever it was just treated medically, which is completely the wrong direction.
Okay, so talk to me about that, the sort of completely the wrong direction, insular silo medical approach
Correct.
versus a broader interdisciplinary holistic approach. Give me the points of contrast there, and what do you see as the value of that more holistic approach?
So in the 70s, when anorexia and bulimia were defined and diagnosed, the treatment was a very, they would just take young women, anorexic women, and intube them in the hospital and force feed.
Just force feeding.
Right,
Wow.
which would save your life, but it did nothing to get to the underpinnings of what was really going on. And so the lovely part about the interdisciplinary team is, what we know is that if you're dieting and starving, you will be completely consumed with that. You can't really even work psychologically until your food is straightened out and you're not fighting all of the really nervous system responses to hunger and the pain of and the guilt with eating. And so back and forth, it's sort of like this, we're going into the world of dieting and eating, and then we're coming back over here with the shame and the pain and the all the self-criticism and judgment. So acceptance and lots of compassion begins this process that then allows this to shift, and as this shifts, this shifts. And the physician part is really only for really medically complicated people, like people who are binging daily. We have to really watch. That's really the most dangerous. And in terms of medical issues, anorexia, of course, when they're under a certain BMI, but people can stay at those low BMIs their whole life.
Yeah.
I've treated women in their 60s who have 5'7", weighed 105 pounds for 30 years.
Wow.
And live on water and mushrooms and a little yogurt here and there.
Wow.
They can live forever.
Jeez.
I mean, not literally.
Not literally, but they can
Yes.
just get that stasis and
Right.
remain there.
But their quality of life is this
Yeah.
narrow. They have blocked out all joy and enthusiasm, and this is where kind of the obsessive compulsive part kicks in.
Yeah, I'm getting a sense that not only is the quality of their life that narrow, but even the experience of their life is that narrow,
It
that
is.
they've become so rigid.
It is, right.
So one of the things that's intriguing to me is in what you're talking about is that I almost get this sense of, as you're describing the sort of tapestry of treatment, that each kind of attention to emotional or nutritional or
Right,
medical
that is
issues opens up other possibilities.
Yes.
That I could easily see how any one approach by itself would be inadequate.
Yes.
But I can also appreciate the remarkable complexity of being able to weave that tapestry, and how maybe some professions wouldn't even be necessarily trained to do that.
That's true.
And so it would be almost a fool's errand from the beginning
Right.
to have a single approach that didn't understand or appreciate the multiple ways in which this eating disorder gets ramified.
You're 100% right. Carolyn Costin is sort of goddess of this area, and her work from the very beginning said it is a disease of the soul. And so you know, she has, you know, the most successful treatment centers on the West Coast, and very hard to get into, of course. But she's the one who treats the really extreme people, and it's that delicate weaving between the confidence and the sense of self coming back that will allow eating to begin. And we work with what we call intuitive eating, which if you've ever dieted, you've kind of lost it. And everyone in our culture is dieted to a certain degree. So in terms of, you know, not being told out here what you should eat, but from in here, which takes time to learn. So that's where that weaving comes in. And it's an art form.
And so you're really trying to reestablish a kind of harmony or connectedness to a natural food as a natural part of living.
And some of the women I've worked with, you know, one of the first questions I ask them is, when did you start dieting? And this is before they've told me they were dieting, but I know. And they're surprised, and they're like, my mom locked the refrigerator when I was 4. And the message that was there. And they have been semi-restricting and then binging and then gaining weight for the last 20 years. But that's not technically an eating disorder, but their life's miserable.
Right.
All they think about is how they hate their bodies. So that body shame part feeds the eating, then back and forth and back and forth. And this is where the fourth part of the treatment is group, which I've done for 25 years, and it's always the most well-attended group in the center. It is delightful to see the changes over time just from the support of other women. Nothing is more vital to the whole approach.
And so that's the distinctive contribution of the group per se, is the kind of support and affirmation of the overall group, who have shared similar kinds of experiences.
Absolutely. But it's all secret. What keeps an eating disorder alive is secrecy and shame, particularly bulimia. It just keeps it fueled, like any addiction in a certain way. And so when they're sitting together and they're hearing someone say something that they've thought or felt, but never really admitted, it's just like things start to melt, and they can start to not be so afraid of food.
Interesting. And so having the opportunity in a safe space to give voice to what they've been experiencing, and then to have it resonate with a chorus of other voices is affirming and liberating, as I'm understanding it in some ways. The secrecy is gone.
They feel like they get their lives back. The self that they were before they started dieting.
So it's really interesting, because you've said this several times in different ways, and it really intrigues me. You said they get their life back. So we're not talking about just a disorder that Roberta has, or a disorder that Greg has. We're talking about an alteration or an interruption in the life story in some ways.
Absolutely. If you think of the term anhedonia, you know, lack of joy, it's like when you're suffering from this chronic daily self-hate, body loathing, and then restricting of food, which is our very, very basic thing that we need. It's the most primal thing. When you're ignoring that and then stuck in this darkness, everything comes down here, and the sense of curiosity and engagement in life is very limited. It's not that these young women cannot excel. They can do the math, they can do their homework, they're excellent, they're brilliant. They say this is the good girls disorder that happens to the best and the brightest. And that's my experience.
Oh, interesting. You know, it's just, I never quite thought of it in these ways before, but I'm almost getting, I know it's not a good heuristic necessarily, but I'm almost getting a sense of a sort of Maslowian hierarchy of need.
Yes, absolutely.
Where when they're down here, they can't attend to these meta issues. I mean, they're disconnected from their food source.
Absolutely.
So a lot of things get shut out, a lot of awareness.
Sex drive.
Zero
sex drive.
You
know, and that for a young woman is very disconcerting.
You know,
they want to date, but you know, that's not off the table.
Wow. So really, we're talking about not only threading together many different things and approaches at one time, but there's also a kind of necessary sequencing. Kind of like if somebody comes in and they're cocaine addicted and they have an anxiety disorder,
Right.
you kind of have to address the cocaine.
That's exactly right.
Okay.
So you have to address the food.
Interesting.
And there's so much shame about that,
Uh-huh.
that's why we don't send them to typical dietitians and nutritionists, because they can just exacerbate. They do diets.
I could see that, yeah.
So you have to work with a eating disorder nutritionist
Mhm.
who's trained in what we call body acceptance
Mhm.
and size acceptance,
Mhm.
where you are not, the correlation between health and weight is not a one-on-one deal
Right.
anymore. We know this.
Right.
And that adiposity does not breed ill health.
Mhm.
What breeds ill health typically is shame,
Yeah.
where you've been dieting and you won't work out and you hate your body, and we know that leads to many more medical issues
Mhm.
than, my greatest dance teacher of my life weighed 210 pounds, and she didn't care, and she moved across the floor like a fairy.
Uh-huh. That's great.
Yeah.
So when you're working with these populations, whether it's with anorexia or bulimia or binge eating disorder or whatever it may be, when as a clinician do you get a sense that you're starting to get through or starting to succeed? What happens that lets you say, okay, this is working?
That's a great question, and I think it has to do with eating, that they went to BurgerFi.
Okay.
Yeah.
Okay.
With their friends, and
Uh-huh.
they didn't throw it up.
Okay. And they didn't feel shame.
Right.
They didn't feel self-loathing.
Right.
They didn't start cutting.
It's pretty much the marker. Now
Okay.
that you mentioned it.
Okay.
And then from that comes a sense of satiety,
Mm-hmm.
because when you're starving all the time, you're not a very happy person.
Mm-hmm.
So, which most eating disorders are a blend of restrict, 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 eat a little bit, or restrict, 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 binge.
Mm.
And so it's always like the slingshot going like this. And this life feels terrible, and then there's some, kind of, the weight gain begins on this side. So what we try to do is moderate that slingshot back to, can you eat oatmeal this morning?
Mm-hmm.
Try it. And then an enormous amount of just support and encouragement.
Mm-hmm. Because the internal world, as you're describing it to me, I almost get a feeling of a roller coaster life.
Yes.
Where I'm just...
Constantly. It's like an addiction. And the word in our way of thinking, we don't use it, but a lot of women really respond to that, because they say, I was fine, and then I got a phone call and I was at Dunkin' Donuts before I knew it, and there was 12 donuts down before I just wanted to die.
Yeah. Yeah.
So that, to me, is addiction, and when I say that to them, and they treat it like that, for some people it's really helpful.
Yeah. It gives them a coat rack to hang the concept on. It feels like they're addicted.
Yeah.
It feels like they can't
no
help
question.
themselves. Yeah.
No question. Middle of the night eating is so big on this campus. Publix at 2 a.m. getting gummy bears.
Really?
Mm-hmm.
And just, it's just part of a binge?
Do you know what the number one binge food is?
No, what?
Guess.
I thought it was Twinkies.
That wouldn't be mine. Cereal. It's easy to vomit, but it's also childlike. Child time. It's
Interesting.
Cartoons and TV and checking out of whatever's difficult in this current time.
Why do I get a sense we're back to object relations theory?
Here we are.
You know what I'm saying?
Yeah,
Childlike.
absolutely.
I hadn't thought about that.
Right. Yeah.
So there are developmental themes in there that you're...
Well, the way that we look at it now, doing a lot with trauma, we're looking back and we're looking at a period in time where their life was fine. And when you talk to them, there's no sense of urgency in the body or threat, and they're calmed down. When you're in that state, we want to eat. With high threat, we don't want to eat because we need to be able to run, in theory.
Right.
So we go back to the time before they started dieting, and they start to get to know that time better and remember it, because these years have darkened all of it, and they just see themselves as a disaster.
So you literally are doing kind of a reclamation of the self when you're doing this
Absolutely.
therapy.
That's what I think the really fine writers are finding, and the theorists and researchers.
Oh, interesting.
Yeah.
So I want to talk with you just about a couple other quick things.
Okay.
One is because you've brought up the sociocultural themes, and I'm really interested because in the 20 or 25 years you've been practicing, a lot has changed socioculturally, but a lot hasn't.
Correct.
So help me understand how things have evolved or devolved in just sociocultural consciousness
Right.
that bears down on the factors that contribute to eating disorder?
So in the 60s, there was some wonderful research that did a study on the size of Miss America and of a Playboy centerfold. And they were both somewhere around 5'5", 140 pounds. The current Miss America or a Playboy centerfold is somewhere about 5'8", 5'9", around 120 pounds.
Oh.
So it's a complete distortion. And Photoshop and the internet has just doubled it for people. They have no sense of reality.
So we're not photoshopping to make people more full figures. Is
No,
this what I'm
we're
getting?
not.
We're
Right.
skinning them down?
Yes,
Uh-huh.
yes. And when you really see what is done, and students, and when I do lectures, they know this is happening,
Uh-huh.
but they can't. They still only see what the Photoshop showing them. So it's a permutation of the same message, just differently.
But now at the same time, we have this bizarre sort of supersize it mentality, right?
Exactly.
I mean, so we're
That's
encouraging
Right.
more food intake, but
Right.
yet the standards are more and more
Right.
severe for.
If you look in a woman's magazine or online, you'll get an ad for Ben and Jerry's right next to a model who hasn't eaten in a year is what she looks like,
Wow.
So you're right. Those images, bigger, more fries. You remember French fries when we were little?
Yeah.
Yeah, and so here it is, and that's like a huge binge food.
Yeah. Jeez. What if you were? So I'm getting the sense that more things changed, the less they've changed. That you're dealing with
Right.
some of the same social-cultural influences
Pretty
writ
much.
large today that you were a decade or 2 decades
Yeah.
ago.
I think there's a small subpopulation that is getting it, and those are people in what we call the body acceptance movement.
Uh-huh.
But they're still, I never even get very large women in my office.
Uh huh.
And we know from the research that larger women stay sick and larger because they don't want to go to the doctor to get weighed because they're humiliated.
Right.
And we've actually done a lot of programs that weight isn't a necessary part of an exam anymore. We don't really need that. It doesn't indicate much.
But it's interesting, the failure to go do help seeking in part because it does get privatized and they don't want a
Yeah.
humiliation
Absolutely.
or exposure.
Right.
Interesting.
Right.
Interesting. So if you could say something to somebody who is at that stage that you bring them back to, when they feel good about themselves, eating is natural, and then they start to get these messages about you are dumpy or you are too
Yeah.
fat or you're not getting the part.
Right.
The earliest sort of exposure to these socio-cultural messages, whether they're in the media or whether they're personal by a dance instructor or a family friend or whatever, what would you say to a young girl or young guy who's getting those messages and feeling uncomfortable about themselves
Right.
as a consequence of what they're being told?
Well, I'll tell you, it is not easy, and I feel so much for young women because they haven't come into their own authority yet. And the authority, and young men too, particularly gay men, out here, what this traffic will bear is what I will be. So that's where that's where the work is. That's where group is so important, is to foster this sense of their own strengths and their own qualities. And it's really soul restoration work. Who are you really other than your body?
So you really would be encouraging them to listen to their own voice and to silence the chorus of dissonant voices out there.
Exactly.
And pay attention to who you are.
For example, get off social media. That's one of the first things. Facebook, a student told me yesterday, I have 700 friends, I'm completely lonely, and I hate all of them because they're so happy and I'm not. It's that phenomenon.
Wow.
And so between that and even walking through your grocery store lines and ignoring the covers of magazines, there's tricks we teach how to live in this culture and feel good about who you are.
So filtering out those noxious
Yes. And for little kids, emphasizing sports and the function of your body over the form of your body, or your intellect, or your poetry, or yourself as a musician. And when you start to really focus on those aspects of who they really are, it tends to lessen. We've also found research that said that women who are in altruistic, have altruistic career motives have much less probability of developing an eating disorder.
Oh, interesting.
They're not focused here.
It's about giving to others.
Mary Pfeiffer said it. That altruism was the way to work with eating disorders.
Wow. Interesting. Well, I appreciate, Roberta, you're taking the time and talking with me. It is altruistic on your part.
Yes, it is.
And I appreciate your courage and candor in sharing with us the kind of experiences that you have in working with people who are struggling with issues having to do with eating. So thank you.
My privilege. Thank you.